So this is Intro to Finding Peace in Pain and Chronic Symptoms. I wanted to let you know I'm certified in something called pain reprocessing therapy, which is trained in many different nervous system reset tools and emotional healing tools and relational healing tools. And I am also certified in something called biblical counseling. So I have a background in biblical Christian counseling and experience in ministry, which also lends itself to having spiritual aspects of healing included in the work that I have with clients. As I was trained in pain reprocessing therapy, I also joined a cohort with others who were trained in that. And we continue to meet once a month to staff cases for people with chronic pain and chronic symptoms. And it's so exciting to be able to do this work with clients. And common neuroplastic conditions that we often see for those of us who deal with chronic pain and chronic symptoms are things like fibromyalgia, IBS, long COVID, many migraines or chronic fatigue syndrome, complex regional pain syndrome, chronic Lyme disease, interstitial cystitis, and a number of other conditions. In fact, as I meet with clients and I work through their conditions, there is a book written by Clark, Schechter, and Schubiner called The Diagnostic Guide for Psychophysiologic Disorders that I usually refer to just to kind of get an idea of whether or not there is a component to be able to help in terms of what we call mind-body syndromes. And I'll tell you a little bit more about that. The first thing I want to do is to affirm your experience of your pain and symptoms. A lot of us have gone to doctors and they've explained that a lot of the symptoms or pain is exacerbated by stress. And so we don't know what to do with that. And a lot of the time, whether it's a autoimmune syndrome or some other, even cancerous situations, the medical diagnosis is there, but the explanation for some of our symptoms, there is none. And so a lot of people have gone to the doctor and tried to get a little bit of help to be able to survive, in a sense, kind of the feelings and the symptoms and the pain. And it's a challenge to be able to get through that when we don't feel like we're heard or understood, or that we're being even validated for the experiences that we have. So when it comes to how we feel, are we saying our pain is real or our symptom isn't real? No, it is definitely real. We definitely have chronic pain, chronic symptoms. And so even as I share with you today some new information, I just want you to know I validate your pain, your experience, and I'm excited to share some things that are going to be exciting for you to be able to apply. So my story started when I had my first child, and I began having some tendinitis in my hands, which then moved over to my shoulder, my back, my lower hip, my SI joint, my front kind of groin area. I started having knee pain in my right leg. They thought that that was some kind of torn meniscus. I started having excruciating pain in my left foot. And along with that, I started having lots of GI issues, not just IBS, but reflux. And we found out that that was laryngeal reflux. So it was silent reflux, LPR is what it's called. And then I was having chronic sinusitis, sinus symptoms. And I was getting laryngitis all the time. I was getting injections in my back and my hips and my knees. I had a knee surgery that I might not have even needed to have had. And over time, as a counselor, I started just looking more and more into what is the source of this? Because I was seeing a specialist in just about every system of my body, except for a cardiologist and a dermatologist. So I was seeing them twice a week for at least a number of years ago, and none of them could point me to kind of the core reason for all of these symptoms. And so they referred me to an endocrinologist. And most of the time, when a person gets referred to an endocrinologist, there'll be something that isn't quite perfect, because we are not perfect human beings. And so I was given a not otherwise specified autoimmune disorder and more medication. And I began reading a little bit about what is it that causes a lot of all of these symptoms and this pain when there is no origin. Nobody could give me an origin of a lot of it. Well, as I started reading, I also came across different types of training in terms of dealing with chronic symptoms. And I decided to get trained in pain reprocessing therapy, while also seeing a counselor myself who was trained in the area of dealing with chronic symptoms. I started to heal, and I was able to get trained to be able to start helping others heal as well. So I can honestly say that right now, I really have very little to no symptoms left of all of the different chronic symptoms that I had. And I have been dealing a lot with healing from the, what I call gross analogy, emotional constipation that ended up kind of building up and amplifying a lot of the symptoms that I had. Since then, I've been able to treat a number of clients with a number of different symptoms. Some of them are ones that don't have an origin. Some of them have some type of structural damage, like cancer or some other deformity that is not able to be repaired. So what I'm going to ask you to do as I share the rest of this presentation is that you examine if you have any fixed beliefs about your symptoms, about the cause of the symptoms, about what exacerbates or amplifies the symptoms. And instead, I would encourage you to loosen your grip on some of those fixed beliefs and practice what I teach all my clients: curiosity and compassion. Because if you have some of that curiosity and compassion, then your brain's going to be in a place to be able to receive some reframes or new ways of perceiving what you are experiencing. And trust me, you will be so glad to be able to have some of that open-mindedness. All right, so one of the first things I want to share actually is a little video about kind of new pain science, because a lot of the doctors that we've seen don't necessarily view pain or chronic symptoms in the same way. And this is an excellent video that was put out not too long ago by the professionals or professional organization for people who treat what's called neuroplastic symptoms. So I'm going to show that to you. It's brief, short, little video, and then we'll continue the presentation after that. And hopefully you can hear it.
Hi, I'm Jenny. I had 23 years of chronic pain. 5 years ago, I couldn't walk more than 3 blocks. Now I hike easy 12 miles, salsa, pickleball, all the things.
Hi, my name is Alec Casson. I'm a former semi-pro cyclist, and I used to be partially bedridden on strong painkillers. And now I do 500-mile bike trips without even thinking about my back.
I used to suffer from chronic back pain, and it was difficult to get out of bed. And now I run every day and play with my daughter.
I received a diagnosis of long COVID. I couldn't walk or talk.
Now I can run, I can dance.
I was diagnosed with tendonitis in both of my wrists.
Now I can sit all day long at my computer and run my
unable to get out of bed. Now I can rock climb.
Like I'm stronger and better. I don't feel as
I can
afraid.
jump. I can do anything I want.
Recovery from knee pain was dramatic and
They could say 17 migraines a month to none.
Just about to run my first full marathon.
I performed on Broadway with no pain.
Now there's nothing I can't do. It's a whole new life.
I'm Dario Zagar. I'm a neurologist with Yale University.
I'm Dr. Becca Kennedy. I'm former lead of the Long COVID Clinic at Kaiser Permanente Northwest.
I'm Yoni Ashar. I'm a neuroscientist at the University of Colorado.
All pain is real, and all pain is generated in the brain. These things are revolutionary ideas.
There's new science about how pain is made. Pain is not made out in our body by our nerves.
So if you put your hand on a hot stove, the hand actually sends signals up through the nerve pathways into the brain.
The brain picks up on that neurochemical message and then begins to communicate with other parts of the brain saying, hey, I think we've got a problem here. We need to pay attention to this.
Most of the time, the brain does a pretty good job at letting us know when there's a threat or injury to the body and creating pain to protect us. You know, ow, don't touch the fire, it's hot. But sometimes the brain gets confused.
I think it's helpful to think of the idea of safety and threat.
We now are learning that pain is really a protector. It's a signal from the brain that we are in danger.
And that when it feels like it is under threat, which may happen because at times it was, it can continue to perceive sensations or feelings or experiences as being threatening.
Coughing is a good one. Let's say you're sick, you have phlegm in your system and you need to get it out. So your body, as a survival mechanism, we've developed the capacity to cough. So maybe 15 years ago, I got a virus and I was coughing, and that's, you know, quote unquote, a danger signal or my body's way of alerting me to a certain threat. And for 2 weeks I was coughing, right? There was an actual reason for it. But after that, it caught. So even after the danger or the threat was gone, my brain was actually still interpreting danger. So I developed a chronic, what we call neuroplastic cough, where I was actually coughing for the next 3 or 4 months. There was no reason for it. My brain was actually interpreting danger where there was none. And I was coughing. And when I realized that it was essentially a false alarm, I was able to overcome it.
The Boulder Back Pain Study found that of the people we treated with chronic back pain, average duration of pain was 10 years. 3/4 of them were virtually pain-free in 1 month. In a study at Harvard, Mike Donino, our colleague, found that 2/3 of the people he treated, again, with chronic low back pain, were virtually pain-free within a couple months.
In my recent study at UCLA, nearly 2/3 of patients with chronic musculoskeletal pain had a clinically significant improvement.
At Northwestern University, they scanned the brains of people who had recently injured their backs. And they found that the brain activity associated with back pain was in like the pain processing parts of the brain. But then they followed these people for 1 year, and half those people got better. But the other half had developed chronic pain. When they scanned their brains again, they found that the pain had shifted to a set of regions related to emotion and learning and meaning making. And they basically caught on camera using a brain scanner this transition from acute to chronic pain, suggesting that once the pain has shifted to these other set of brain regions, its activity in those regions can cause the pain to continue on loop.
The fear of the symptoms is a really big driver. It's what the loop basically is you have the symptoms trigger the fear of the symptoms triggers the fear.
Pain gets really learned in the nervous system. And just as we can learn symptoms, we can unlearn them.
I thought, there's no way. There's actually no way I can change my brain and address these incredibly severe and debilitating symptoms.
You know, it's understandable to have doubts about this. This is new science. What we're doing here is on the forefront of biomedical science. But the studies that are coming out and the research that is growing and being published, the results are just phenomenal. People are recovering from all kinds of chronic pain, long COVID, all kinds of chronic symptoms.
Migraines.
Chronic fatigue syndrome. Post-concussive syndrome.
Symptoms blamed on chronic Lyme.
Sleep sensitivities.
Dizziness.
Pelvic pain.
POTS.
Fibromyalgia.
Sciatica.
Bladder pain.
Digestive problems.
Plantar fasciitis.
Tremor.
Brain fog.
IBS. Skin disorders. I could go on and on and on.
It's the biggest blind spot in healthcare, and it's a problem that's got a solution.
And the beautiful part of this is when it's a nervous system problem, we can help you.
Hi, I'm Dr. Matt McClanahan, and I've successfully treated hundreds of patients.
I have seen hundreds of people heal from these methods.
At least 80%.
80%
To 80%?
The majority of my patients.
The majority,
Majority, hundreds of patients.
thousands.
Dozens.
Over 7,000 people successfully improved.
I have thousands and thousands of people who were formerly hopeless that are completely well.
This is a paradigm shift in thinking. It is a radical new way to think about the body.
A lot of this is so counterintuitive to everything we've ever done.
My patients tell me this is a real revolution.
I can't believe how limited of a life I lived and how tragic my future looked.
We're going to look back at the way we treat chronic pain now, the way we look at, using leeches in the Middle Ages. Like everything's going to change.
I want the world to know that we really can rewire the brain. Oh, just get the word out.
Hey, I love that video. Thank you for watching that. Okay, so I just am so excited to be able to share with you some of the building blocks that kind of help us to begin the work, to be able to find peace in pain and chronic symptoms. The peace, though, has to be in our body that we feel, and we've got to start with our brain, because that's where a lot of pain and chronic symptoms are starting, as that video explained. So what I like to share with clients is two parts of the brain that are really important to help us deal with chronic symptoms. So I've got this little fist up there. I couldn't find one with a thumb inside, but if the thumb could be inside, that would be ideal. So this fist is going to be kind of an illustration of the brain. And where the fingers fall over is what's called the prefrontal cortex, or the frontal lobe, which we are not born with. We need different parts of our brain to be able to function. And the frontal lobe is developed around the age of 25, which helps us with things like impulse control and seeing things objectively and being able to look at not just the black and the white, but the gray and the red and the orange and all the different nuances of things, being able to see the whole forest instead of just focused on the one tree. And we need this part of our brain, and we'll have more of it when our brain is what I call in a place of peace. Now, the back base part of the brain is the limbic system. For kids, we might call it the lizard brain, because all creatures have and are born with some type of limbic system, a protective system to keep us alive. As a baby, we had the one protective measure of being able to have a primal cry. And then over time, over our childhood, we learned to be able to practice the other survival strategies that we gained. So things like fight, flight, freeze, fawn. You've probably heard a number of those. And when these get triggered or were triggered in childhood, then we're in kind of a survival state. When this part of the brain is actively trying to keep us alive, let's say running from a burning building, then it's going to shut off normal processes that take energy from running from the burning building. So our GI system, our hormones, our immune system, and then inflammation is going to come as a protective measure. So we kind of want to thank this part of the brain for keeping us alive. However, sometimes this part gets it wrong. And so we've got to help train this part of our brain to be able to know that we're safe, so that we have more frontal lobe. So in a sense, we have a brain at peace to be able to treat a lot of what the brain's reactivity is to our chronic symptoms. So perhaps you can relate to some times when your limbic system was activated in what I call a stressed brain state, or danger messages. Like, have you ever noticed a time when a simple question or an email or a text starts to send your heart or mind racing, and you feel urgency and pressure to know how to respond, and you feel like you have this pressure and intensity to do so now and do it perfectly? Or have you ever had a family member or a spouse ask a question or make a statement in a way that was plain and simple, but you took it personally as an attack or a threat or an intrusion? Have you ever found yourself avoiding or dreading or shutting down? Have you ever struggled with falling asleep, staying asleep, or waking up sometime between 3 and 4:30 in the morning with your mind racing? Have you ever felt overload or overwhelm? So these are a lot of examples of this part being really activated. So we want to be able to treat that part, help that part come back to a place of safety. Often worry, pressure, and self-criticism, if those are any aspects of what your brain tends to do, those will keep the brain in a chronic state of stress. And then that is going to amplify or dial up any sort of chronic symptom or chronic pain. Another thing that can cause a lot of our brain to react to certain things as dangerous, even if they aren't, is how our limbic system was programmed since we were kids. So I grew up with lots of different codes to live by to keep me safe. So it was my fault. I needed to fix it. I was responsible for getting it right. And I've got to do things perfectly in order to avoid getting in trouble or some rejection. For me, that is how my limbic system was programmed. So later on in life, I was still operating with some of those same old inner scripts, which were keeping my brain in that stressed brain state. And so amplifying other symptoms or pain in my body. So one of the first things that I like to explain is what is pain. So pain itself is just a messenger. It is not dangerous. That's hard to understand or accept because it's not comfortable at all in our body. But the message itself, the actual pain, isn't dangerous. It's just a message from the brain. So one example of that signal kind of received from the brain is if you were to break your leg. Let's say you were running, you broke your leg, and then your brain is going to come up with a symptom of pain so that you stop and you don't just keep running. Well, that message is a care for me message that the brain is giving. I need some care. So the message, the pain message, isn't dangerous. It's just telling us that we need some sort of care. But as you saw in the video, some of the interpretation of what care is and the interpretation of what pain is isn't always viewed in that way as just a messenger from the brain. So this is where I like to explain about two different types of pain that are really important for us to understand if we're going to treat chronic pain or chronic symptoms. So the good news is our brain has something called neuroplasticity, which means we may have some grooves in our brain that are burned in one direction that keep us going in the direction of amplified pain and symptoms. But because our brain has neuroplasticity, we can burn new grooves in another direction. There are two types of pain, and the one type is nociceptive pain, which is the example I gave earlier, where if we broke our leg, our brain is going to say, stop, don't keep running, go get care. And then we kind of know that it's going to be real uncomfortable to have that broken leg set again, and then really uncomfortable to have to wear a cast or a boot or go around with crutches or a scooter. And then we're going to also understand that we're going to have to go to physical therapy, and that's going to feel really uncomfortable. But we seem to understand the nociceptive pain response or nociceptive symptom. There is something called neuroplastic symptoms, which is where the brain gets it wrong, where there may be some type of actual tissue damage, but the brain continues the pain message or the symptom message, even when it's like pulling a fire alarm when there's no fire. And so the brain can create a certain pathway where even if the body is healing or adapting or getting used to its new situation, the brain can interpret messages as if they were dangerous. So it's kind of like if I were to toss you a baseball, but your brain thinks it's a hand grenade, you'll respond as if it was dangerous, even if it's safe. So the brain, if the brain interprets these messages as dangerous, it will amplify a sensation, kind of like a hearing aid. So if I'm talking at a 2 out of 10 volume, but you've got the hearing aid cranked up, I will be amplified up to like a 10, even though I'm actually still just talking at the same level. It's the same thing with neural pathway pain, the volume knob in our brains. And if that gets turned up, that'll be interpreted by the brain as to how much danger it thinks that you are in. Other things that increase the danger messages are our fear thoughts. Like there has to be something wrong all the time. So always that undercurrent of a message going on in the background. There's always something wrong. I'm damaged. And then that will send the message back to our limbic system of danger, danger, and will actually be like a hamster wheel, increasing, perpetuating the pain message. So we can actually treat that and help the brain eventually to understand what the difference is between uncomfortable, dangerous, and imminent harm, to triage correctly so that our brain is getting the right signal. But that's only going to be able to happen if our brain is at peace and we have more access to the frontal lobe regarding our symptom. So the nerve pathway model, which is kind of how we treat what we call mind-body symptoms or any chronic symptom, or what's also called a psychophysiologic disorder, or what was termed by the late John Sarno as TMS, tension myoneural syndrome, is this pathway that our brain can form going to these areas of our body, increasing neuroplastic symptoms. So even if there is no more actual injury, there's a misinterpretation of the signals in the brain. Now, I will say this, that there are structural problems we can have in our body. However, most structural issues in our body don't always cause pain. They're simply what we might call normal abnormalities. In fact, there was research done in the New England Journal of Medicine that 64% of people with no back pain that they did a study on, they actually had disc bulges, herniations, degeneration. So they went in and were evaluated. They didn't have any pain, but they had symptoms that other people that had as well, but they experienced pain. That study showed how much there is a nerve pathway that can be formed in the body, even if we have what's called normal abnormalities in the body. So when it comes to treating this neuroplastic response that we may have formed from our brain to amplify our symptoms, we've got to address some of the barriers at first, because there are barriers to accepting any of what I've just shared with you today. And in fact, there's very few people who will even accept what I've shared with you already just now, because they are determined something is wrong and they don't want to open their mind to the fact that there's a way of burning new grooves, in a sense, in our brain, so that we're no longer in that stress state with these fixed nerve pathways. So some of the barriers to kind of dialing down the symptoms are if there's just not enough buy-in. And I just kind of talked a little bit about that. There's also what's called a hope disappointment cycle. So we get hope that maybe this new bed or these new shoes or the weather or something like that might help reduce or dial down the symptoms, and then they don't. So then we get disappointed, and so then that kind of can affect our buy-in. Also, there is an instinctual belief that humans have that physical pain always means physical damage. And some conditioned responses that we can have are that pain is linked to always physical positions, certain activities, or certain shoes or chairs that we sit in or things like that. But the brain can make these associations or conditioned responses. The other thing that's a challenge, that's a barrier to kind of dialing down our symptoms is this is because of the way we receive medical diagnoses and the way that often a lot of doctors treat diagnoses is with a fear-based communication. So having a diagnosis means I'm damaged, I'm wrong, I'm bad, I'm in danger, when really a diagnosis is often just a name for a number of different symptoms. And most people don't have to have, just so you know, 100% buy-in of this idea of neuroplastic symptoms being able to heal and burn new grooves. You don't have to have 100% buy-in, and you won't necessarily until you've seen some of that reduced. A couple of other barriers are if your motives are to please a certain person in your life, your family, or if you start addressing whatever your symptoms are with intensity and pressure, because that's just going to keep that limbic system dialed up. And then similar to someone who maybe has been obese and then they've had some type of surgery to help kind of make their stomach smaller, some kind of thing that has helped bring their weight down extremely. Some of those people have had a hard time even seeing themselves as not obese. They've lived that way for so long. Maybe you've heard of that before. Well, the same thing happens when it comes to chronic symptoms or chronic pain, is sometimes we just have a hard time letting go of that sensation. And so the brain doesn't want to burn a new groove in a different direction. And then one of the biggest barriers to being able to grow and heal and apply some of what I'm sharing with you today is family. So, oops. You may not be able to see all of this, but it's basically describing a cycle that happens with our family members and caregivers, where we've got family helping with various daily tasks. And so then the more loss of control that we feel because of our symptoms, then the family steps up doing even more. And then if we kind of try to do certain things and have a flare up of our symptom, we might feel angry and frustrated. And then the family tries to help even more. And then some people get to the point to where the family members do it all and overinvest. And so then the patient becomes kind of deconditioned. So less and less functional capacity. Sometimes the family then disengages or ignores the person. Sometimes we have that going on, which is a little bit discouraging for us. And then we may be experiencing more occupational changes, depression, anxiety, and then the family can either withdraw or start increasing more support again. So this cycle is a challenge with families, and so if you decide to continue to get help dealing with your chronic symptoms or chronic pain, it will be important to educate your family members as to how they can best help you, because sometimes they can get unintentionally in the way of some of burning the new grooves, because they're used to thinking about there always being a problem and kind of being at our beck and call. And so we can help them understand a little bit. I do want to share some of the results of working with things like pain reprocessing therapy and other treatments dealing with chronic pain and chronic symptoms. Let's see here. So some of that is reduced fearful pain beliefs. So the more that we find exceptions to our situation where certain times the symptom is less, or sometimes it doesn't even show up, we reinforce evidence that our brain has different grooves and we can burn some new grooves. We also can find more ability to find safety and appraise our situation for safety and be more present minded, which really does help kind of calm this part of our brain to safety. So we have more frontal lobe and can see other options. We also then will have a broader view of our sensations. Instead of just immediately, uh-oh, I'm starting to feel this symptom, we can view a symptom from that lens of safety, because pain isn't actually dangerous itself. It's just a message. Then we can also kind of broaden the neural pathways in our brain, so that it's not just this one rut all the time, to the pain or the symptom. We also can grow in healthy emotional and relational functioning once this is kind of dialed down a little bit, and then we have a little bit more peace in the brain. And then the benefit is often some reduced sensation. So it is not, for some, it goes away completely. And for others, it's at least reduced to where it is manageable, even if they have regular symptoms. So there is hope for symptoms being dialed down and finding peace under the layers of all of the conditioning that we've had in our brains. And so I just want to share that I have had numerous experiences with different clients with different syndromes. Some of them have cancer, and so we're working with some of the pain, the neuroplastic pain that is on top of kind of what their body is fighting. I've also treated a woman who had a very large tumor that was in her lower back on the right side, removed. During that time, when she had that tumor removed, the doctor told her that there was some nerve damage in the surgery, and the client got an immediate nerve damage response inside of her brain, when actually nerve damage doesn't always cause any sort of pain. In fact, there's often a lot of numbing when it comes to some nerve damage. And so her brain formed a pathway to excruciating pain where that tumor was removed, leading her to be unable to walk even 8 months after the surgery had been done, when normally she would have completed physical therapy and been able to walk again. She was extremely atrophied in her right leg, excruciating pain at night when she would try to go to sleep. And so when I started to see her, really within a couple of weeks, she was able to walk with just a cane. And then just a few weeks later, unassisted, which was incredible considering she had 8 to 10 months of using crutches anytime she had to move anywhere. Now, that client also had the benefit of being able to address some past trauma in her life, which amplified a lot of emotional responses, which amplified that limbic system response and amplified her symptoms. I've also had a client who was debilitated with chronic migraines. She had a really hard time being able to predict when they would come or not come. And so after a while, she had to start working from home. She wasn't able to go into her work. She stopped going to her church because the stimulation of church, the noise, the people, everything just kind of amplified her migraines. And she stopped exercising because she just couldn't leave outside of her home really without the migraines being stimulated. Over time, she was able to address some of those chronic migraines, be able to return to work. She was a runner. She was so excited to be able to return, to be able to go to running, and even to going to church again. Those are just a couple examples of clients that I've been able to see. So this is possible. I just want to give you so much hope that it can take time, and depending on how many barriers we're dealing with, also affects how much time it can take for us to heal. So I do want to share with you, as some of you know already, that I am operating with a group coming up, and that's going to be this October 7th through November 4th, once a week at the same time. and hopefully you'll be able to join us. I'll tell you some of the skills covered in the upcoming 5-week group are reducing kind of the preoccupation and fear surrounding symptoms so that you can have a new relationship with your pain or symptoms. So there's not this continued amplifying of that connection or pathway in the brain. Some other skills are going to be kind of thought skills, thought evaluation of inner scripts, preoccupation. We'll address kind of Schubiner's 5 Fs of fear, focus, frustration, fix and fight, outcome dependence, using indifference, leaning into pleasant sensations, a number of other skills that we will have. And then beyond that, a 5-week group, when I work with clients, we'll address some other skills to be able to help the brain continue to burn some new grooves and heal from some of what actually might have even caused the brain to form the chronic symptom in the first place. So I just want to say thank you at this point in time, and I appreciate you for your time and listening.